Welcome everybody to CanFASD's network series. This one is about thinking about FASD month. I actually can't believe we're in June again already. This seems like we just did this a few months ago, but it has been a whole year since we've done it. So thank all of you for joining us today. We're really excited to be able to provide you with some support and inspiration for your community or your provincial planning for FASD month. My name's Audrey McFarlane, and I'm the Executive Director of the Canada FASD Research Network. The Canada FASD Research Network recognizes the historical significance and contributions of Indigenous people and their cultures and understands the important role that Indigenous communities play today and in the future. We acknowledge that we live, work, and meet on traditional territories across Canada of many of the First Nations, Métis, and Inuit, whose footsteps have marked these lands for centuries. This is an important step in reconciliation in the acknowledgement of the treaty lands or traditional treaty lands and the recognition of people of each of the territories. We have three excellent presentations for you today. And so we'll stop after each one to answer a couple of questions. And then at the end, hopefully we'll maybe have a bit of a conversation. So we have three presentations, as I said, to provide you with the foundations for FASD awareness, best practices for talking about FASD and FASD prevention, and then a campaign that is excellent that was launched this year that we want to share with you. So with all of that, I'm going to introduce the speakers just before each of their presentations so that you remember who each of them are. So we're going to start with Victoria Bailey, who received her Bachelor of Arts in Science degree from the University of Guelph in 2016 and her Master's of Science Communication degree from Laurentian University in 2019. Her master's research was conducted in partnership with Public Health, Sudbury, and districts and focused on developing effective message frameworks to communicate information about social determinants of health. Victoria is passionate about health communication and is excited for the opportunity to share about the incredible work that CanFASD does with the rest of the world. And she is also our amazing communications manager, doing all of the wonderful things for CanFASD that gets our information out to the public. So Victoria, take it away.
As Audrey mentioned, my name is Victoria Bailey and I am the Communications Manager with CanFASD. I live, work, and play on the traditional lands of the Anishinaabe and Haudenosaunee people, so I'm in Cambridge, Ontario. And I'm here today to talk to you about our FASD awareness plans. So as you all hopefully know, September is FASD month and September 9th is FASD Awareness Day, and it's celebrated both nationally and internationally. It's held on the 9th day of the 9th month to raise awareness of the importance of going alcohol-free for the full 9 months of pregnancy, and it was first held in 1999. We all know that we need more support for FASD prevention, diagnosis, and interventions. But we're really having trouble getting all of our leaders and our public on the same page. So FASD Day and FASD month is a great opportunity to bring attention to FASD. But we really need a united front to encourage our leaders and the rest of the public to pay attention to FASD in Canada. So let's just first take a little step back and look at the landscape of FASD awareness in Canada. We often talk about the importance of raising awareness, but we need to remember that just telling someone something isn't enough to get them to remember it or get them to change their minds. So the Frameworks Institute, which is a communications research institute, did a study in 2017 that they published that mapped the gaps between how experts understand FASD and how the public understands FASD. And it was done specifically in Manitoba, but in lieu of a study being done Canada-wide, we can kind of extrapolate those findings and apply them to the rest of Canada. And there's a few key findings that I want to pull out, and that is that people were familiar with FASD, but they often referred to it as FAS or fetal alcohol. They understood that it was related to a range of different impacts, but they didn't really use the phrase spectrum at all. People think that because people with FASD have permanent brain damage, that social supports and services won't make a difference. And that's a big one. And then they also see FASD prevention as being the responsibility of the mother. And all of this contributes to a huge fatalistic perspective surrounding FASD. So the public believes that there's ultimately nothing that can be done to prevent FASD or improve outcomes for people with this disorder. And this is a huge, huge problem in communications because we know this isn't true, but we have to address this narrative because it's a huge barrier to us accessing supports. And one way we can do that is through sharing evidence-based information, sharing consistent messaging, using non-stigmatizing language, incorporating the voices of those with lived experience, and taking a strength-based approach, because we really need to address and overcome this misinformation if we want to raise awareness. So historically, community leaders and organizations have done an amazing job at creating events and campaigns within their own cities and regions, and some are awesome. But it can be really time consuming and resource intense to create your own graphics, create your own theme, create your own messaging for this event. And with different organizations, individuals all across Canada creating their own campaigns that aren't necessarily well versed in FASD language or the research or the best practices behind it, it opens up the risk for misinformation and miscommunication and stigma and the perpetuation of some of those key narratives that we actually want to overcome. So what we end up with is pockets of different messaging all across the country. So for example, for FASD Awareness Month, if we have this group in Alberta, this group in Saskatchewan, and this group in Nova Scotia, they're all talking about FASD, but they're all using different messaging, different graphics. So at first glance, it does not appear like we're all talking about the same thing. It looks like 3 different communities raising 3 different concerns. But conversely, if we all use the same messaging, the same graphics, the same consistency, at a first glance, it looks like we're all talking about the same thing. So it adds more power behind the communications that we're doing because it looks like more of us are on the same page. We are on the same page. When we talk about FASD, but it looks like it when we have consistency in the campaign. So we want to make sure there's consistency across Canada in the messages that we're using and sharing during the month of September, so that the community leaders and government leaders and the public realize that this is a concern that communities across Canada are raising. It's not just these pockets of communities. Everyone across Canada has the same issue that they're trying to overcome and raise. And it also helps reduce confusion within the general public as people may be exposed to different campaigns that they might experience. If they're exposed to the same campaign, it can help reduce confusion. And just driving this point home, the best practices for communications is to share the same messages over and over and over again in different formats. From multiple sources, because people are more likely to remember something if they've seen it before, and they're more likely to believe something if they get it from multiple different sources that they trust. So CanFASD, us, we are taking the lead on drafting some messaging and graphics for our FASD awareness campaign that you can build on within your own communities and organizations. And our goal is to take on that behind the scenes work, that research, that development of messages, so you can extend more and devote more time and resources and energy and money into the fun things that actually make a difference and connect, like community events. So this year, our focus is on overcoming that fatalist narrative that we talked about before, which is that people see FASD as permanent brain damage, and the public incorrectly thinks that once someone has FASD, there's nothing they can do to help. What does this mean for our communication efforts? Well, when we talk about FASD, it's important to help the public see that healthy outcomes are possible. And that is more important than sharing the challenges. And that's why this year, we're really focusing on strengths and abilities, because we want to counteract that negative fatalist perspective that the general public tends to hold about FASD and this disability. We need to make sure that people know that healthy outcomes are possible, and people with FASD can and do succeed when they have the right supports. So our current and future themes are grounded in this research, our common message guidelines, the best practices that Lindsay is going to talk about next, this frameworks report, to make sure what we're doing is actually pushing FASD forward and not unintentionally perpetuating these narratives that people hold about FASD. So that's why our year theme this year is building strength and abilities. So historically, we've talked a lot about the challenges that people with FASD have. And that is really important because it can validate people's experiences and bring attention to areas where more supports and services are needed. But only talking about challenges can also feed into that fatalistic perspective that we just talked about. It's equally, if not more important, to also look at the strengths and abilities of people with FASD. Why? Because when we don't explore the success of people with FASD and celebrate their contributions, we fail to recognize their immense potential. And that's why our theme this year is building strengths and abilities. And it goes beyond just celebrating people with FASD because it also recognizes and holds space for the strengths and abilities of families, of community members, of those who are pregnant and parenting, because all those play into the narrative of FASD. So what does this look like? In families, only focusing on strengths and challenges can again perpetuate that stigma stereotyped about this disability. So we need to recognize strengths and abilities to help balance that narrative, balance that story of FASD and help people with FASD achieve their full potential. In communities, what it looks like, many Canadian communities, especially those in rural and remote locations, are great at using their existing knowledge and resources to best meet the needs of individuals within their communities. So sharing those success stories through FASD month is really important to counteracting that fatalistic narrative. Strength-based approaches that shine the light on effective ways of responding to local needs, stories about that is really, really key. And then in prevention for girls, women, and people who are pregnant, it's really important to recognize and celebrate what you're good at. Addiction supports we know should be focused on harm reduction and skill building. And to do this effectively, we really need to draw on people's strengths and interests. And we need to provide information and support about alcohol and pregnancy that really empowers people and that builds on their skills and abilities. All right, so that being said, that's all the background behind our campaign. What does our campaign look like this year? Socially, we're aligning a little bit more, so socially being the media side, social media side, we're aligning a little bit more with Red Shoes Rock this year. And they are a community-led, community-driven international organization. And they help raise awareness of FASD, and their symbol is red shoes. And you've probably already heard of this before. But why red shoes? RJ Formanak, who's touted as the starter of this campaign, he wrote a blog for us actually 2 years ago called Why Red Shoes, and it answers that question for you. And I won't take away from that blog because it's a really good read and I really suggest you go look at it. But I will share one quote from the blog that's on the screen here. I can fit in, but I'm not the same. Let me be me and I will make you proud of that decision, because when you allow me to be myself, I can help change the world. And again, I think that really exemplify some of that building on our own strengths and abilities rather than having us fit into a box of what we think we should be good at. So that is our focus this year is Red Shoes Rock and sharing that symbol across FASD Awareness Month. And we think this is a really great campaign because it's an easy, tangible way that people can get involved. And it's a good social movement because it's a great way for people to share their own voice and put their own spin on things. So this is a tweet that we did actually just last week at our Together for FASD conference. And you see it's got a little bit of a different spin than this tweet from last year's FASD awareness activities from the Hamilton FASD Collaborative. So you see how we can use the same theme, use the same messages, and share some different stories about FASD and really connect. We also are creating graphics. CanFASD is about FASD month. We have some sharing our theme, asking people to share their own strengths and abilities through the Red Shoes Rock hashtag, and really draw attention to that, as well as remind people that FASD Day is September 9th and September is FASD month. And then as a national organization, it's really challenging and we're really limited with what we can do physically. It's really hard, it's sometimes hard to meet everyone where they're at in a social media sense, because people are trapped in the social media bubbles where it's really hard to penetrate those bubbles if they're not already connected with our organization or your organization or an individual over here. And that's why physical displays are so important, because they really help connect people and engage people beyond our social bubbles. So what we're doing this year, we're asking Canada to rock red for FASD. So what that means is we're getting a bunch of monuments and buildings across Canada to light up red in honor of FASD Awareness Day on September 9th. So this is the Sails of Light in BC and Niagara Falls in Ontario. Those are two of the locations on our list. This is our full list of organizations we're putting in requests to. They haven't actually agreed to say yes yet. This is just where our requests are coming. We tried to spread it out across Canada and really tried to hit on major cities or capitals. We are missing some provinces and territories here, as sometimes monuments aren't necessarily all available, but we know we're missing some buildings. So if you have areas or monuments or buildings within your area that you'd like to add to this list, we really encourage you to reach out to those organizations, contact them, ask them to light up red for FASD Day. And if you do have a monument that agrees to do this, we're going to put a form on our website so you can fill out that form, and we'll add that list of monuments to our website so that everyone within the area knows that they can go to that monument and it will be lit up red in honor of FASD Day. In addition to that, we also are looking towards more community events this year. Again, we are restricted as a national network with what we can do. And that's why community-based events are so important, because they really help build those connections with people in physical spaces. So here's some suggestions what people have done last year or previous years, what you can do. You're not limited to this list. This community is so creative, and I'd love to see what everyone comes up with for FASD month. But for example, you could run an FASD awareness walk, where you can plan to walk through your city with a group. You can make a big impression by starting at a landmark in your city, so maybe City Hall, or ending at City Hall. Dress in red, bring signs that share FASD awareness activities. You could host a community barbecue or community lunch. You could post lawn signs, posters, or billboards throughout your city. This is something that the South Alberta FASD network did a few years ago. They actually purchased during COVID a bunch of lawn signs that shared September as FASD Awareness Month, and then posted them throughout the city. And I thought that was a really cool way to overcome COVID and do an event during lockdown. Another cute idea I really love is painting rocks red. So organizations and individuals paint rocks to look like red shoes, or paint rocks red, and then put FASD awareness information on the bottom of them. And then they hide them on local trails or within their city for others to discover. I think that's a great way of also raising awareness. Maybe you could go see the lights. If you're in a community where something is being lit up red for FASD, you could gather a group and go see the lights. But if you are hosting an event, we encourage you to let us know, because we want to help spread the word. So we're going to have a form on our website you can fill out to tell us what you're doing, when you're doing it, and where you're doing it, and we'll share it on our channels to help community members get involved. If you are planning an event, please be sure to follow all the rules and regulations of your local municipality. And as a national not-for-profit, we do reserve the right to restrict some events if they do are the sharing of some events if they don't align with our community values. So just a heads up there, but we do encourage you to share your event with us, and we will try to put that online. Ideally, I wanted this to be present before this webinar, but alas, sometimes life has other plans. We will send out our package for FASD month next week. We have a list of organizations and groups that we're going to send it to. We will also send it to you all on this webinar. But our resources can always be found at our FASD month site, FASDmonth.ca, or in French, Moisdutsaf.ca, and that again should be up next week. So what you can do to help: follow us, download the toolkit, and engage with FASD awareness activities within your community. The public, again, has that pretty fatalistic narrative of FASD, but we can really change that when we use common messages and celebrate and build on our strengths and abilities. So thank you very much for listening, and I will hand it over to Audrey, who will hand it over to Lindsay. But if you do have any questions, feel free to put those in the chat.
Thanks, Tori. That was really great. So if anyone has any questions, please pop them in the chat. Tori, I have one question. So just on a practical basis, the resources that you showed with all those great graphics and the messages, those will be available in the kit for people to download for their social media. Exactly. And is there a space for them to put their own agency or community group on there?
Yeah, we're going to have a space for logos up in the top right corner of some of the graphics. So we'll have that outlined in the package that goes out. So you can always put your own branding on the stuff as well.
Oh, that's great. So then that should save a lot of groups that are smaller, as you said, don't have the resources and the time to spend developing all these great campaigns. And none of us are experts on developing social media campaign, at least I'm not, and I'm sure a lot of community folks aren't, but so that would make it a lot easier for people for sure. All right, so we're going to move on to Lindsay Wolfson, who holds a Master's of Public Health, Social Inequities, and Health from Simon Fraser University. Lindsay's a researcher with CanFASD Research Network and a research manager at the Center of Excellence for Women's Health. Lindsay's background is in anti-violence field, and she's currently responsible for research and collaboration on projects related to Indigenous health and wellness and fetal alcohol spectrum disorder prevention and the integration of gender, trauma, and equality informed approaches to policy, research, and practice. So basically, Lindsay does everything. And we're so glad that you're here today, Lindsay, to share with us the things that we should be keeping in mind in terms of our best practices for these campaigns. And I apologize for the continuous coughing. I'm still recovering from COVID a few months ago, so bear with me. Thanks, Lindsay.
Thank you so much, Audrey. What a kind introduction. And it's actually a huge honor for me. I feel like I've been very privileged to be sandwiched in between these amazing presentations. And while I'll largely be speaking to FASD prevention, my examples of the principles, I think that in the next presentation with Reyna and Chelsea, they'll really be showing how they've been able to enact all of the principles I'll be speaking to within an FASD awareness and prevention campaign. So I just want to take a minute to acknowledge the people in the land. Today, I'm joining from the traditional and unceded territory of the Lekwungen-speaking peoples, including the Songhees, Esquimalt, and Wasanich. And particularly as we are in June, we are in National Indigenous Peoples Month. I really want to pay my respects to the elders past, present, and emerging from all the lands in which we are joining on today, and really remain committed to the Truth and Reconciliation Commission's calls to action. I'll largely be speaking about Call to Action 33 on FASD prevention and the National Inquiry into Missing and Murdered Indigenous Women and Girls, the calls to justice. So I think before I go into some of the principles behind prevention campaigns and awareness campaigns, thinking largely in my lens of prevention, it's really helpful to think about why women or people who are pregnant may use alcohol during their pregnancy. And there are so many reasons. It could be a lack of awareness of the pregnancy. It could be before pregnancy recognition, not necessarily knowing about FASD or the harms of alcohol use in pregnancy. The social norms around alcohol, it being really challenging to be in social circumstances. And for anybody who may have been at the Public Health Association conference yesterday, there was a really great presentation on alcohol policy and just showing how much targeting has been going towards women and girls. Alcohol is often frequently used to cope with difficult situations such as trauma, violence, depression, poverty, and isolation. And then we can also think about addictions. There's really a myriad of reasons why alcohol may be used in pregnancy. And these are all things that should be considered as we're developing awareness campaigns. So when I'm thinking about awareness campaigns, I'm thinking about these sort of areas that are emboldened in gray. This first level of prevention, thinking about awareness building, health promotion, and alcohol policy initiatives. And of course, that is interconnected and related with other areas of prevention. So discussions around alcohol use, specialized and holistic support and postpartum support. And I think, thinking about this model, this 4-part model of FASD prevention is really important because all of these levels are integrated and build off of one another to reach different populations and support in different ways. So here are some examples of level 1 prevention initiatives. We have awareness and health promotion, and so that can include health education materials and awareness campaigns. We have health promotion materials, and so that could be things like materials for group facilitation, community-wide health promotion strategies, and then we have alcohol policy like the low risk drinking guidelines, warning labels, or other policy initiatives. And here are some examples that we have. We have an example from the Saskatchewan Prevention Institute, another from BC Liquor, from Yukon, and all really great and different ways and different strategies of reaching populations to raise awareness about FASD and FASD prevention. And here are some things I think that are really helpful then when we're thinking about the campaigns. We want to consider that a campaign should be understandable, it should be noticeable, but not in an adverse way. So we really want it to influence and encourage information seeking and convey how to make positive change. We want it to be in an area where it invites recall, and it should be integrated in other activities. And I'm going to speak a little bit to that point before going through some of the principles about campaigns in further depth, because I think it's really helpful in just exemplifying how we can do this work in such a different way. So this is an example of a campaign from Manchester. This was something that they worked on a few years back and they're currently reporting on, and it was called Drymester. And this campaign was targeting women 18 to 50 and their families. And it was really about raising awareness of the risks of alcohol use during pregnancy, thinking about the impacts of FASD, and reflecting on the chief medical officer's advice around alcohol use in pregnancy. And the campaign was really effective. It used the language of no safe time, no safe amount, so very similar to the language that we use here in Canada. And it showed a really strong reach, 4.5 million views, and over half the people who saw the campaign really responded positively, and more than 1 in 5 said the campaign was excellent. And prior to that evaluation, 73% of people who were surveyed felt as though it was an important message, but that increased throughout the campaign. But Drymester was only part of a strategy. In addition to Drymester, there was a whole alcohol reduction initiative or alcohol exposed pregnancy reduction initiative that also include an adaptation of project choices. So a brief intervention focused on increasing alcohol use and contraception use. And it saw that not only was there then awareness raised about FASD, but there was also integrated support, so that way professionals receive training as to how to support women who may be at risk of having an alcohol exposed pregnancies. And women were then identified and were able to receive the support that they may need. And so it really showed the value of having a multi-initiative FASD prevention effort. So going back to the principles, there are 4 that I'm going to talk about today. And I think that these can just be really important and examples, because we can walk through them together and show bottom. And while, seemingly innocent, it can make women feel like their only significance is to be pregnant, and can also perpetuate misinformation that women who use alcohol in pregnancy are doing it maliciously or are bad mothers, rather than recognizing that there are many reasons why women may use. There are also so many campaigns, both about FASD and FASD prevention, that are really jarring. And that prohibits women from being able to speak to trusted providers, because the public portrayal really looks like there's intentionally causing harm. And so instead, we can think about how messaging has a really big impact, and we can use language and images that are encouraging, that say something like no safe time, no safe amount, this very neutral, or it's never too late to cut back, or no alcohol is safest. These messages that still allow change to be elicited and conversations to be further had. And this is a campaign that CanFASD has done. And you can see here, it's quite neutral. It's non-stigmatizing. It really normalizes a reduction of alcohol use, and it invites an entire population. So we're not just thinking about women or pregnant people in particular, but we're thinking about everybody and who all may be involved in a pregnancy journey. And this is some work that CanFASD has done. I know that Andrew's planning on putting this into the chat box around language and images matter. And I think this is really important because it allows us to think through, these nuanced changes in language and how impactful they can be. Recognizing that while FASD can be prevented, it is not 100% preventable. And while the health of an unborn baby may act as motivation to stop drinking, slogans that use scare tactics, such as really large warning signs or suggesting that women who drink may be uncaring or irresponsible, can really elicit shame and guilt and stop women from seeking support. So moving on to our next principle, this gender transformative approach, I think the language of gender transformative can be really intimidating, but really what we're thinking about is improving equity at the same time as we work on health promotion. And so here are a few campaigns. Again, I've re-highlighted this one from Saskatchewan, This Is Why I Chose Not to Drink, and another from the BC Aboriginal Network Disability Society about healthy pregnancy, healthy baby, healthy nation. And these campaigns really take the sole responsibility of use off of women and pregnant people and promotes sharing their responsibility with partners and friends. Sorry. And I think campaigns really have this challenging goal because they're thinking about how to both be inclusive and universal simultaneously, but they can really be the most effective when they're tailored to an audience. And so that may mean linking to culture or suggesting social support. The example at the top, Be Her Pre-Testy Bestie, that's a New Zealand example, before pregnancy recognition and they have like small video clips where they're somebody's at a party and they don't know that they're pregnant yet. And so she needs to hold anything but a drink. And so her friend's with her and like hands her a lamp and hands her a broom and hands her all these other things. And it's really fun. We can do fun things as part of our awareness initiatives. And then I think about this example from the Yukon, which was so effective. Let's meet at the coffee bar. But when a campaign was being developed in Nunavut, and they suggested a similar tactic, they realized that the other territories' approach, while also northern, wouldn't be as relevant because it implied that folks could meet at a coffee bar and that there were coffee shops in different parts of the territory. And lastly, when we're thinking about that fourth principle, aspiring to quality practice, it is so important when we're thinking about campaigns to balance the level of threat with what can be done. And most successful campaigns really look at that bottom row, whereby the ability to take action is higher than the threat. And therefore, we have a higher level of efficacy than we do threat. And I think that Reyna and Chelsea are really going to speak to that quite a bit, or show that quite a bit in their presentation. And here are some ways that we can see it. We can see it with the example on the right. This one's from Nunavut, which says, let's all support substance-free pregnancies. And it's quite strengths-based. You see a community approach, you see the land, and also you see a website. And both of these, what they include, both from Manitoba and from Nunavut, they include contact information, and they include messaging that people are not alone in their pregnancies. And so that really encourages folks to contact health providers, be engaged with their social support networks, and make changes together. And so I'm going to end up here with what we can think about as a checklist for FASD prevention or FASD awareness campaigns. Does the content align with current guidelines or scientific evidence? Is it understandable? Does it encourage follow-up and information seeking? Is it clear, simple, and direct? And has it been designed with a particular audience in mind? And I think it can be really hard to do it all, or I think that's the perception. And in 2019, I'd worked on a campaign where we really discussed how to create a poster that was compelling, that would draw the eye in with bright colors rather than scary warning labels, that was inclusive to diverse groups of women, that was gender and transformative and would include partners, support networks, and communities. And we really struggled how to do all of these things in only one poster. And I think that's something that we all think about. How do you do it all? How do you integrate all of these different examples? And the reality is, I think we just have to do it with a lot of intentionality. And that particular poster, which I still wish I could share, but I can't, ended up having a group of women with, rainbow bursts of colors behind them from all different racial backgrounds, ages, abilities, perceived class, and really tried to show that alcohol use in pregnancy and FASD affect all populations, and that women can act as a source of support for another. And I think in our next presentation, as I said, Reyna and Chelsea will really see that checklist further in action and show the ways that we can do quite comprehensive campaigns that take these principles in mind and are destigmatizing and really supporting of folks. So thank you so much.
Thank you, Lindsay. Your talk really reminds me how complicated this all is, but also how far we've come. I was one of those early groups in the 90s that had designed, the pictures of the woman with a glass in her hand who was pregnant with a slash through her. And I think about how awful that was, but that was our frame of reference at that point in time. And so we evolve, we change, we should be growing and learning from the evidence and from what those with lived experience tell us. So thank you so much. Now it is my real pleasure to introduce the next two presenters. So Chelsea Giesel received her Bachelor of Public Affairs and Policy Management degree, specializing in international studies from the Carleton University in 2015. She focused on peace and conflict studies in East Africa and did primary research on reconciliation in post-genocide Rwanda in 2014 for her honors research essay. After volunteering in international human rights organizations, Chelsea realized and decided to focus her efforts on the inequities occurring in her home country of Canada. Chelsea has been working with the Pauktuutit Inuit Women of Canada since 2019 and is deeply committed to the empowerment of Inuit women and families and the improvement of Inuit health across a number of indicators. And we also have Reyna Uriarte, the manager of health programs at Pauktuutit Women of Canada FASD project, which seeks to build capacity within Inuit communities, fosters FASD awareness, reduces stigma surrounding FASD, and support prevention and education efforts within a gender and Inuit specific context. Pauktuutit mandate is to promote a greater awareness of the needs of Inuit women and to encourage their participation in community, regional, and national concerns in relation to social, cultural, and economic development. And thank you so much. I feel so lucky to have you guys here to share this really great campaign that you've put together. And I don't know how many times you're going to make me say Pauktuutit and how many times I'm going to get it wrong, but perhaps you can share with us the correct pronunciation. Thanks, take it away.
That would be my pleasure. Thanks, Audrey. And thank you, Victoria and Lindsay, so much for all that praise. I hope that we can live up to it. And you were very close, Audrey. It's Pauktuutit. Some people do pronounce the last T, but it kind of really depends on the region of Inuit Nunangat that you're from. So some people say Pauktuutit, but yeah, so there's some variation allowed. All right, and let me just share my screen. All right, so as was mentioned, we are joining from Pauktuutit Inuit Women of Canada, and I'm joined by Reyna Uriarte, who's the Manager of Health, and my name is Chelsea. And we're so lucky and excited to be presenting the Beauty and Brain Difference campaign. And that is all about supporting Inuit families and communities that are affected by fetal alcohol spectrum disorder. So as we all know, fetal alcohol spectrum disorder is a lifelong disability that affects the brain and body of a person exposed to alcohol in the womb. But for Inuit specifically, like with many other health challenges, Inuit in remote communities face obstacles when it comes to trying to access FASD diagnosis or services. So Pauktuutit Inuit Women of Canada received funding from Public Health Agency of Canada to explore how FASD is understood in Inuit communities and how those that are affected by it are supported. So our ultimate aim is to improve maternal and infant outcomes and the related services for Inuit women and their families related to FASD. So throughout our project, we engaged with Inuit service providers and families affected by FASD across Inuit Nunangat, which is the Inuit homeland in the north, as well as Canadian urban centers where there's large Inuit populations, so that we could learn from them about their experiences related to FASD and experiences in trying to access services and support. We also completed an environmental scan, kind of collecting and looking at the different services, supports, and resources that are available to Inuit. And from this, we developed a community of practice with participation from across Canada of FASD subject matter experts, service providers, and Inuit with lived experience. And we created this to inform our activities, but also to create connections in FASD awareness and service delivery for Inuit across Canada. So from our environmental scan, we did hear and learn about a growing number of Inuit-led and culturally safe FASD services that are available to Inuit communities. But participants in our community consultations did share that while access to services has improved over time, there are still social and physical barriers that prevent families from obtaining diagnosis and or the appropriate services that they need to meet their unique needs. Many individuals still go undiagnosed or unsupported due to a range of barriers that are specific to Inuit. Some of these barriers include the physical distanced services, since specialized services are often only offered in southern urban centers. There's also cultural and social barriers and a lack of interpretation and translation available to Inuit who may be unilingual speaking Inuktitut. There's also limited awareness and understanding about FASD in remote communities, and this is often due to poor funding. Another factor is the criminalization of Inuit women or women in general who consume substances during pregnancy. And outdated medical record keeping is also an issue in small remote communities, and the lack of continuity in care. So medical teams either need to fly into remote communities, or people accessing services need to fly to urban centers in order to access testing, support, and care. And like Victoria mentioned in her presentation, stigma was shared as a huge barrier that Inuit felt prevented them from accessing FASD support. And some of the ways that stigma interacts with other factors to create barriers for Inuit is, for one, the need to disclose consuming alcohol during pregnancy in order to get a positive FASD diagnosis. And often to receive services, you need a positive diagnosis. As well, we mentioned the criminalization of Inuit women for consuming substances makes them afraid to disclose consuming substances during their pregnancy to their healthcare providers. Stigma can also deter those who are affected by FASD in adulthood from seeking a diagnosis. And like I mentioned, it's harder to access specialized services if you don't have a diagnosis. And of course, many service providers who serve Inuit communities are not Inuit or Indigenous, and therefore they don't have a good understanding of the links between colonization, social determinants of health, and substance use for Indigenous and Inuit, and therefore can make judgments or generalizations which make Inuit feel unsafe accessing care. And stigma surrounding FASD and alcohol use during pregnancy is a barrier to having open dialogue that could eventually lead to conversations that might prevent alcohol use during pregnancy. A number of service providers that we spoke with mentioned the need for improved awareness and understanding about FASD within healthcare, education, policing, and at a community level. And they are confident that with improved levels of awareness and learning, we're optimistic that this can reduce some of the stigma around FASD and potentially reduce some of the social barriers that Inuit face when trying to access services. And I'm pleased to say this brings us to the Beauty and Brain Difference campaign.
Yeah, thanks, Chelsea. And thank you to my other panelists and for Audrey for that introduction. So what is the Beauty and Brain Difference campaign? This Inuit specific awareness campaign is a collection of resources guided by Inuit values and knowledge aimed at ending FASD stigma through recognizing the strengths and diverse perspectives and realities of Inuit with FASD. You'll see Arctic flowers and okpik or cloudberries are heavily featured in the imagery of the campaign to symbolize that despite extreme conditions like the Arctic climate, given the right circumstances, these plants can thrive, just like Inuit affected by FASD. This campaign includes a number of different tools we carefully selected with our advisory committee to address FASD stigma. A key element of the campaign is the proposed messaging, grounded in dignity promoting and harm reducing language. This messaging is weaved throughout the campaign, but is also contained in a separate standalone resource. And just should have mentioned that previously, but we put a link just in the chat for the Beauty and Brain Difference campaign if you wanted to peruse while I talk. The messaging has been reviewed and translated by an Inuit-specific FASD organization based in Iqaluit called the Pauktuutit Resource Center. Their involvement was really imperative in ensuring that the messages are rooted in Inuit values and still conveyed accurately when translated from English into Inuktitut. We also created social graphics as part of the Beauty and Brain Difference campaign, some of which we have featured here. You can see how the flowers and berries analogy comes through on the bottom post. People living with FASD blossom when their unique strengths are recognized and supported. These templates are intended to be shared on various social media platforms to start discussions and demonstrate to others yours and your organization's recognition of the strength of people affected by FASD. And at the end of our campaign, we successfully reached over 306,000 unique users through Facebook and 265,000 over Instagram, focusing primarily on Inuit Nunangat, which is the 4 regions up north, and urban centers with large Inuit populations. The toolkit also includes posters that can be printed and displayed in brick and mortar locations like health centers, schools, and daycares. The left one is one of 7 options that share Inuit-specific messaging about FASD and advocating for the appropriate support and treatment of Inuit with FASD. One of the messages that really stood out for us was if we were to provide comprehensive prenatal care, sexual health care, food security, safe housing, and if all of the social determinants of health were on par with average Canadians, then that is FASD prevention. And that was shared with us by a service provider during our community consultations. And it resonated so well with us that it ended up on a poster. So we also have the discussion guide that outlines some basic information about Inuit and FASD and shares some tips about how to have a productive and stigma-free conversation about FASD. So it outlines terms to avoid, like suffering from FASD or FASD person, and offers non-stigmatizing alternatives like person affected by FASD. Or as Lindsay mentioned, instead of using language like FASD is 100% preventable, we can say that prenatal alcohol use and the reasons for them are very complex. Lastly, but not least, the toolkit also shares additional resources from other FASD service providers or organizations. So viewers can learn more about FASD and where Inuit can access these services and support. Our hope is that this campaign will act as a form of support for Inuit affected by FASD to help lessen barriers they face related to stigma and help the world recognize the incredible strengths and valuable perspectives that they contribute to the diversity of our community. So. And in closing, we'd like to share this short clip created for the campaign to demonstrate the beauty and brain difference. So, Panamik, thank you, merci. And yeah, I guess we're taking some questions after this video. So thanks, folks.
Everyone sees the world a little differently, and our worldviews are shaped by many things. People living with FASD have unique perspectives. FASD is often misunderstood, but it's helpful to think of FASD as a brain difference, because when we are understood, we blossom. So open your eyes to new perspectives. Let's end FASD stigma and see the beauty in brain differences, because all brains are beautiful.
Yeah, so thank you.
Everyone sees the world a little different.
2 times. Yeah, so thanks everyone. We really appreciate it. As Lindsay wrote in the chat, I feel the same way. I feel very emotional when I see this video. So every time I watch it, I smile and I tear up a little bit. So thanks for letting us be here and providing this platform for us to share it.
Oh, well, thank you for being here, and thank you for the work. I think it's so, it just encapsulates how far we've come, really speaks to the strengths and the worth that people with FASD bring to our communities. And so, you know, it's just so heartfelt, it feels like, when you watch that and when you look at all the resources. So have you seen an uptake in the actual toolkit and the print resources from some of the service agencies?
I guess I should have checked our final report before I came on here. So we had a massive reach, and I think the toolkit download was significant. However, bandwidth is still an issue. So what we'd like to do with a little bit more funding, do you like the way I sort of circumvented that answer really? What we'd like to do with a little bit more funding is develop a dissemination phase 4, I guess, or phase 3, I think. So we can get some of these in print to the regions. That's our hope. We'd also, I think, at some point like to look at translating it into other dialects as well. But of course, with more funding, as we advocate, yes, that's kind of our next step plan. So.
Oh, excellent. Yeah, for sure. Because I think that those resources would be really helpful. And I also like the way that you develop them, that I think that they'll also have longevity of time. So you're not going to have to redo them in another year or 2 years, which often sometimes campaigns are really time sensitive, right? So great. Okay, well, thank you everyone for joining us. We wish you good planning for your FASD Awareness Month. And if you need support or help, we are here. And we really want to hear what you end up doing. So make sure that you link back to the CanFASD site and tell us what you're up to so that we can share that. And if we take some pictures of the monuments that get lit up so that we can have some pictures, because unfortunately my budget does not allow Tori to travel around the country to take pictures of all of them. So anyway, thank you so much. Enjoy your weekend, everybody. Take care.